In terms of what we can do post-treatment or after clearing the acne, oftentimes people are going to see some erythema. So we have fantastic devices for that. We can use a pulse dye laser. We can use a 589 nanometer laser. We can use anything that's going to target the red. In terms of those patients who have the post-inflammatory hyperpigmentation or even acne scars, there's lots of techniques that we have now, and some are very, very inexpensive. So in terms of the acne scars, we can use plain old-fashioned microneedling, and you don't have to spend a ton of money on these devices. If you talk full MSRP, you're talking about $6,000 for one of these little devices. The cartridge is between $59 and $79, depending on how much you buy. And you can do a triple method. So you pass it sideways on top, and then you do a little circular method. You combine that with something that's going to control our human microbiome, you get an amazing result. And inexpensive, both for you as well as for the patient. We have other things like radiofrequency microneedling that's going to address both the pigmentary option as well as the types of acne scars that you see, whether it's a rolling scar, a box scar, or even an ice pick scar. So the latest generation of that is a pulse wave technology. It's called Sylfirm, Sylfirm. Because it uses a short-term pulse at the 300 micron depth, which none of the other devices do, just below the DEJ, you're able to cause apoptosis of that superficial vasculature. You're improving the basement membrane. We've seen on EM, electron microscopy, that there's better anchoring fibrils, and it resets the melanocytic activity, so you're removing some of the pigment. But before you spend hundreds of thousands of dollars on any device, think about chemical peels. You can spend 5 cents to 25 cents getting a TCA peel, maybe combine that with a salicylic acid peel or even lactic acid peel. You can get them from any of the manufacturers. And as long as you understand how each ingredient works, tremendous results. Now we even have take-home products from a company called Clarity RX. They call it vegan-based or plant-based products, and that's inexpensive for the patient. It's about $80 retail, full retail, and they can do that at home in addition to what you're doing in the office to remove some of the pigment. And then, of course, retinols, right? You don't have to spend tons on retinols. You can, if you don't want to go all the way down to Mexico, which I'd rather go to Mexico and get Retin-A, but we have things that we can do that are over the counter as well as professional grade. My favorite retinol still, since now it's been 14 years, is from a company called PCA Skin. They have one called IBT, Intensive Brightening Treatment. What's so unique about their retinols, they use something called Omnisome technology, which they then licensed to Johnson & Johnson. It wraps that retinol, which is a very unstable molecule, as you already know, and with that, you can now add other ingredients. So for the brightening treatment, you can add silymarin, which is going to be an anti-inflammatory. You put niacinamide, which is going to control some of the pigmentary process as well as be an anti-inflammatory and repair the skin barrier. And then it has hexaresorcinol, which is going to be a lightening agent or a bleaching agent. So that combination, full retail is between $110, $120. That one tube will last that patient more than 10 months. And we get tremendous results, not just from the pigment that's there, but also helps prevent acne because of a retinol.